Pranam, Jai Jinendra, and good evening, everybody. Thank you so much for joining us again for our Oshwal Wellbeing and Lifestyle webinars. This is our 15th webinar of the series. Before we talk about today's session, I'd like to welcome Puji Jayesh Pai, who will be reciting the Navkar mantra today. Thank you.
Om Namo Arihantanam. Om Namo Siddhanam. Om Namo Ayariyanam. Om Namo Uvajjayanam. Om Namo Lo Esabvasahunam. Eso Panchanamukaro. Sabbapavapanasano. Mangalanam cha Sabbeshim. Padhamam Havai Mangalam. Arhanto Bhagavanta Indra Mahita Siddhascha Siddhi Sthita Acharya Jina Shasano Natikara Pujya Upadhyayaka Sri Siddhanta Supathika Munivara Ratnatraya Radhika Panchaite Parameshtinah Pratidinam Kurvantu Vo Mangalam Kurvantu Vo Mangalam. Oshwal Association of the UK તરફથી આપ સૌને પ્રણામ. આપ સર્વનું આરોગ્ય સુખાકારી સારી રહે અને ખૂબ સારા કાર્ય કરવાની શક્તિ દેવ ગુરુ અને ધર્મ પસાએ પ્રાપ્ત થાય એ જ પરમાત્માના ચરણમાં વંદના અને પ્રાર્થના.
Thank you very, very much, Jayesh Pai. Tamara khub khub abar. So I would now like to welcome Rumi Shah, President and Trustee of Oshwal Association of the UK. Today, Rumi cannot be with us, but he's actually sent us a short video message, which we will play now. And after this, I will be talking a bit more about today's session. Thank you.
Jai Jinendra and Pranam. My name is Rumi Shah, and I'm the president of the Oshwal Association of the UK. Welcome to this Oshwal Health Talk, Living Well with COVID, Why Vaccines Matter. This talk is in partnership with Brent Council. I would like to thank Dr. Jyoti Shah and Dr. Anuja Shah for providing their valuable insights into this topic. I would also like to thank our partners, Brent Council. Over the last 2 years, we have been living in bubbles, isolation, and in constant fear. COVID-19 has severely restricted our general and social life. However, with the advent of vaccines, we've seen the light at the end of the tunnel and been able to bring back a modicum of normality. Although the vaccines have not completely eradicated COVID-19, they have significantly reduced hospitalizations. We therefore urge all of you to take the vaccines, including all the boosters you are eligible for, and pass this message to all your social circles to achieve herd immunity and allow us to return back to normality. In the meantime, please take all necessary precautions to remain safe, especially in large public gatherings. We the Oshwal community will continue to propagate this message. So get the jab and be safe.
Thank you so much, Rumit Bhai, for that supportive message. Today's webinar is all about the vaccines and the importance of the vaccines, and all of us trying to live with COVID-19 and living well with COVID-19. I'd like to now introduce, and it gives me great pleasure to introduce Nipa Shah from Brent Matters, which is a Brent Council initiative, and Nipa Ben is the program director of that initiative. And they have been working in partnership with us at the Northwest area. That partnership working started some time ago. And recently in November of last year, we held a diabetes event, which was very successful at ECTA Center. And Nipa Ben is here to tell us a bit more about our partnership.
Thank you. Thank you, Prafula Ben. Jai Jinendra, everyone. My name is Nipa Shah, and I'm the program director, as Prafula Ben said, for a program called Brent Health Matters, which is run by all of the providers of health and social care in Brent. So it's not just run by Brent Council. We also have the CCG included, our primary care, so our GP services, our community services, our hospitals, our mental health trust. Everybody's working together to provide that. And the aim of that program is to try and tackle some of the health inequalities that exist, well, all over the UK, but especially in Brent. So many communities, not UK માં પણ ખાસ કરીને બ્રેન્ટમાં એવી હોય છે કે જે ડોક્ટર્સ કે સોશિયલ સર્વિસીસ એ લોકો પાસે જાય નહીં, મદદ માગવા ન હોય, પણ એની જે લોંગ ટર્મમાં જે ઇફેક્ટ થાય છે એ વધારે નુકસાનકારક છે. એટલે અમે લોકો બધી કમ્યુનિટી પાસે જઈને અમે કહીએ છીએ કે what can we do for you? So this program is genuinely about not just telling community that this is the health service and this is what we can do for you, but working with the communities to understand what the communities need from their social care services, their housing departments, and their health services. So we started the program after the first wave of COVID, where Brent as a borough in UK was very heavily hit. And since then, we've been working with all of the community organization, and Oshwal, Northwest Oshwal community, which is at the ECTA Center, was one of the first organizations that we reached out to. And I'm really, really pleased with the support that we've got from all of the members at the ECTA Center, especially Tushar Bhai and Prafula Ben. So back in November, one of the things that we wanted to do was sort of start some diabetes large-scale events. We all know that, diabetes, આપણા બધામાંથી ઘણા બધાને diabetes હોય છે. અને આપણે દવા તો લઈ લઈએ, પણ બીજું બધું જે diabetesનું ध्यान રાખવાનું હોય છે, જેમ કે તમારા ફીટનું ध्यान રાખવાનું, આપણે શું ખાઈએ છીએ એનું ध्यान રાખવાનું, એ બધું ઘણીવાર આપણે જોઈએ એટલું સરખી રીતે નથી કરતા. So એટલે અમારે કમ્યુનિટીમાં જઈને આ બધાની વાત કરવી હતી. And that was the first job I was given when I took this job on. And I was wondering where to start, and that's when Prafula Ben and Tushar Bhai came to help us, and I'm really, really grateful for that. So we did an event at the ECTA Center in Kingsbury in November last year, where I brought all of the clinicians that deal with diabetes to the ECTA Center, and Tushar Bhai and Prafula Ben got all our community together so that we could have a conversation about what is important if you have got diabetes or if you're at risk of diabetes. And as we all know, South Asians are much higher prone to getting diabetes. So that was a fantastic event. I think it was attended by about 250 people. So really, really good turnout. And there's a lot of lessons for our clinicians and our support services, community services, to learn from the community. And as part of the program, we wanted to promote the vaccine. And for that reason, we've asked all of the organization in Brent to apply for a grant where, you know, the council could give you the money, but we wanted the organizations to go and talk to your community, because then it makes much more sense, rather than professionals or your GP or your social services telling people to take the vaccine. If people in their own community are telling them, it would make a big difference. And I'm really pleased that has, you know, Oshwal UK have fulfilled that, and we're going to see that film in a little while. We've also opened up another grant for all of the communities to think about any sort of health and well-being event which will promote people's health and well-being. So I'm really looking forward to getting an application from the Oshwal Association, and I hope we can continue to work like this together for a long time to come. Thank you, Jai Jinendra.
Thank you very much, Nipa Ben, for that lovely supportive message. And we're so grateful for the work that you and your team at Brent Health Matters are doing. We've, of course, got to know your team really well over the last 2 years. And I know a few of them are actually joining in today. And in fact, some of the projects that have also applied for this funding within Brent are also joining today's webinar. So I'm going to talk a little bit about what we're about to see. So this film was actually what was in our bid, the concept of this film, and the idea that Nipa just talked about reaching out to our communities via real people and real stories. So it was very well researched. We've got a lot of community faces in this film, and it gives me great pleasure now to introduce our film in partnership with Brent Health Matters. So Living Well with COVID. After this film, what we've done today is also invited our familiar faces, Dr. Jyoti Shah and Dr. Anuja Shah, to tell us a bit more about the pandemic, the impact of the vaccine program, both the negative and the positive impacts, and then a little bit of chat around where do we go now and what does the future look like. So we'll hear from both of them. They haven't been with us on a webinar for a few months, so it's a real pleasure to invite them back as well. And as I was saying earlier in the introduction, this is our 15th health webinar. And today we're going to share this film that was made and edited by various people. And the result is what we're about to see. It's about 6.5 minutes long. I'd like people's feedback. So on everyone that has joined us by YouTube, and there's a fair few hundred of you that have joined us already. Please do give us your feedback, your comments, and any questions that you might have. So Nikunj Pai, who is working in the background today on our technology, is now going to share that film with us. Thank you, Nikunj Pai.
Radha suffers from muscular dystrophy. She needs 24/7 care all year round. Without the vaccine, it would have been almost impossible to have a normal life. We, as primary carers for her, have had vaccines, and more importantly, all her carers who actually visit. And there is a very large number of carers who care for Radha day and night, who are all vaccinated, and therefore that has provided the comfort.
I think for anyone that is generally a bit vulnerable, the vaccine is really important, and taking the vaccine provides a degree of protection to those people.
I am at risk of infections. It was very important for me to get vaccinated because I was living with my wife, who also has a physical disability, and my elderly parents. We all had our vaccinations and boosters.
It won't stop you getting COVID-19, but having the vaccine reduces the chance of you getting seriously ill and reduces the chance of you dying from the illness.
Rather unfortunately got COVID, so she's had COVID twice. However, without the vaccine it would have been very difficult to manage.
We literally got very little care, or hardly any care, and Mommy and Daddy were having to do most of the day and night care, and were getting very tired.
It's a deadly virus. If you don't want to do it for yourself, do it for your loved ones, do it for the community.
In our culture, communities up and down the country organize some superb events, whether it's social, welfare, religious, etc. And we all attend whenever we can. Why do we attend? To get to meet other people, socialize, interact, and keep us sane and get out in the fresh air as well.
The gatherings that the community has, both social and religious, are very important in connecting the elders of the community to the younger generation. And particularly during COVID, this has been missing for a lot of people because they haven't been able to attend events or go out.
So it's duty of each and every person to ensure that they protect themselves and the others around them when they attend any events.
Ethnic minority groups are harder hit, and it is important for communities to urge them to take the vaccine.
Ethnic minorities and vulnerable people are more affected with the illness, are more likely to get seriously ill, and are more likely to end up in hospital, and unfortunately more likely to die. Now, the only thing we know for sure that reduces your risk is taking the vaccine.
If anyone's got issues with vaccines, please see your local pharmacist, see your GP, meet healthcare professionals and discuss the benefits.
Millions of people have taken the vaccine. Yes, some may see a minor side effect for a day or two, aches and pains in the arms, but overall it's been tested well around the world and people are safe.
The government has now lifted all restrictions for COVID, and we've been urged to go back to our normal day-to-day life. As we're going back into our normal day-to-day life, we feel that COVID has been forgotten a little bit.
The pandemic is still very much here. The virus is mutating, and like other viruses, it'll keep on mutating. Everyone will have to learn to live with COVID.
COVID is still circulating. 1 in 13 people are currently having the infection in the UK.
We cannot afford to have our NHS overwhelmed by this disease. COVID vaccines will be there like flu vaccines in the future, and we must encourage especially vulnerable people to take this vaccine for years to come.
Vaccines will give us protection against serious illnesses and prevent us from going into hospitalization. They may also prevent transmission of the infection. Boosters are also very important, as our immunity due to any natural infection or vaccines can reduce over time. So it's very important for people to take the boosters as well.
The number of people in hospitals with coronavirus is still really high, and a lot of those are people who haven't taken the vaccines.
There are more people in society that get vaccinated, the more chance there is to eradicate the COVID pandemic.
Living well with the vaccine is the future.
We all have a responsibility to ourselves, our families, our friends, and the general community.
The bottom line is, take the vaccine, it can save your life.
વેક્સિન લેવાની ખૂબ જરૂર છે, જેનાથી આપણે સુરક્ષિત રહી શકીએ છીએ અને બીજાને પણ સુરક્ષિત રાખી શકીએ છીએ. માટે વેક્સિન અવશ્ય લેવી જ જોઈએ.
Get the jab.
Jab.
Thank you very much, Nikunj Bhai. So that is the film that was produced as part of our work with Brent Health Matters to promote the message of the vaccines. I wanted to thank a few people who have been participating with us in this work. And so I'll start with Radha, who you saw there in the film, Mailesh Bhai, Jatin Bhai, Bharat Shah from Sigma Pharmaceuticals, Tushar Bhai, Jayesh Bhai, our Vidika from Oshwal Center in Potters Bar. I also want to thank the administrators at the Ekta Center for all their help behind the scenes with the preparations for the grant and, of course, the administration of that work. Of course, I want to thank our two medics who are on that film, Dr. Jyoti Shah and Dr. Anuja Shah. Last but least, the people that actually helped us to produce this film, and there are going to be two different versions of it as well, which will be slightly shorter, which we're going to use to promote this initiative further into the community. So thank you, everyone, very, very much. I'm going to now welcome Dr. Jyoti Shah, no stranger to our webinars, has been with us from the start and present at many of the topics that we've discussed in the past. Dr. Jyoti Ben is a consultant urological surgeon at the Burton and Derby NHS Trust, many miles from London, but you know, that is the beauty of how we're working currently and still able to join us from the Midlands. And throughout this pandemic, like many other people who have been working in the NHS, has been there every single day without taking a break, without taking a holiday, so that they can continue to provide that care for us and our communities and the people that they serve. So for that, I also want to say a big, big, big thank you to everyone who has supported us throughout this terrible time from the NHS. Jyoti Ben, thank you for joining us today. And I know you had a bit of a rush coming home late and then eating really quickly, and here you are. Today's topic that we've just seen, and today's format is slightly different, so we're going to do a bit of a conversation. And I think what I'm going to start with is saw some COVID-19 figures that were released recently going to April, end of April, and that suggests that the highest rates of death are amongst the elderly. So I think the figure currently quoted is just under 500 people. Are you seeing more admissions in hospitals from this age group, younger age groups? What's the kind of, what's the general feeling of admissions now from not just COVID, but, you know, other things that didn't get treated because of COVID?
Thank you, Prof. Laben. Good evening, everyone. Jai Jinendra, and thank you for inviting me back after a little break and respite. It's lovely to see everyone. Rather surprisingly, today we're talking in English. So I'm going to have to practice a bit. So it's a very interesting question. The general consensus in the communities now is that COVID is all over. Everything's open, you can get on a plane, go on holiday, so it's all fine. But actually that's not the picture that we're seeing in hospitals. although we're not seeing as many people as we had at the peak of the pandemic, but certainly our hospitals are still full of patients with COVID. In my own hospital, we have over 100 people still with COVID. And the problem with that is these guys are sick. So we mustn't underestimate how sick people are still getting with a COVID illness. But of course, what that does is that means we can't see and treat other people. So we've got a 2-year backlog of operations, of treating people, of seeing people because of restrictions in hospitals. And so that backlog, that flow still can't happen through the hospital when there are so many people we are treating with this illness. And the bigger problem is there are so many illnesses, it's not just COVID. And it's almost like everything else has had a pause button pressed over the last few years. But of course, whilst we're pressing pause, people are getting sicker and sicker. And so one of the things, for example, in my own specialty, is that we're seeing people coming in with emergency presentations of their disease, whereas normally we'd see them in clinic, much earlier stage of that particular illness. So to give you a small example, one of my common conditions is people who have blood in the urine. Now, normally people who see a little bit of blood in the urine will go and see their GP. And by the way, GPs are open. So if you have a problem, please go and see them. And so then they'd get referred to someone like me in hospital to have investigations. And that would all be done on an outpatient basis. So you don't need to be in the hospital for that. But what we're seeing now is people, because of course, naturally through the pandemic, everybody was told, stay at home. So as we're all good citizens, we followed our leaders' advice and we all stayed at home. But of course, we've ignored our symptoms. We've ignored our body telling us that there might be a problem. And so with that condition, the example of the blood in the urine, what we're seeing now is that people haven't gone to see their GP. They've sat on it, and then it gets to a critical point where instead of just peeing, it's just peeing blood. And then they're passing blood clots, or some people are stopping passing urine altogether. So of course, this is an emergency admission. And most people with that degree of blood in the urine have got a serious illness underlying that. So of course, that means that we then have to do emergency treatment. We have to do emergency operations, which further clogs up emergency beds in the hospital. So the flow is still not happening through the hospital.
And that brings me to actually nicely to my next question, which was, what has been that impact of COVID-19 and how is the recovery going in hospitals? You know, I'm hearing a lot about recovery, lots of people talking about recovery. How is that actually going?
So we need to recover. Everybody needs to recover. Those who have had it, those who haven't had it, and the NHS has to recover. But we've got this insurmountable problem at the moment, which is that we as NHS professionals haven't stopped. So we have a tired, very burnt out, very exhausted workforce. And we ourselves are not immune from having had COVID or getting COVID. And I know people who have had it, recovered and got it again within months. Because what we know is the latest variant of COVID is so transmissible. And whilst we're not getting perhaps as sick as the original Delta variant, we're still getting sick, but we're passing it on so much more. Hence, Anuja statistic, 1 in 13 people are getting it now. So everybody's exhausted, but people are still very sick. We've got waiting lists bigger than we've ever known them. There are, I think the latest figures said there are somewhere in the region of 6 million, over 6 million people waiting for elective operations. I mean, that's ridiculous. How are we ever going to catch up with that? And because everyone's so tired and exhausted, actually, we are seeing people leaving the profession. And I think one of the other things that has hit people is the whole work-life balance, that there's more to life than just a job. But of course, never more than ever now, we need the NHS workforce. I mean, to give you my example, since August, I have worked, I think, almost every single Saturday, either doing an extra operating list or doing an extra clinic. And that's just literally skimming the surface, because of course, whilst we've still got a backlog, people are still coming through the door. And so we've got what's already on our waiting list, the door's open for people to still keep coming through. So it seems a rather insurmountable challenge at the moment. And all the government figures, you know, we're going to set up X number of new hospitals and diagnostic hubs that are going to see people, we're going to get that many more GPs. From where? You know?
Indeed. And then my sort of next one is around media reports, and you of course have just alluded to this yourself earlier. We've heard a lot about patients who have not received a timely diagnosis through the pandemic and now face life-limiting illnesses. What's been the impact of this on the ground, and for you personally, because you've just talked about one of the issues that is faced by some people?
Yeah, sure. No, it's a really good question. Thank you, Prof. Levin. So I mean, I've been working nearly 30 years in the NHS, and I have never seen so many people come with cancers that have spread. And that is a tragedy on every level, not just for the individual, their loved ones, but for us, because we want to get people early in their diagnosis. We want to cure people of their cancer, particularly in 2022, when we have so many things available, so many drugs, so many operations, so much available to cure people at such an early stage. So when, for example, in my own specialty, as you know, I deal with prostate cancer mostly. When I see young men, younger than my husband, now come to me with prostate cancer that has spread, it's devastating. You know, why haven't they come sooner when we can cure them of that illness?
Yeah. And of course, we're hearing that many people who are now in hospitals with COVID are unvaccinated individuals, right? How much additional pressure does this put on the NHS and the impact to that recovery? And we saw in the film everyone understanding why we need to take the vaccine, but of course there are some individuals who still may not have taken the vaccine. So what's the sort of impact of that to the recovery? And then what would your sort of final message be to those people?
So this is very simple. We have a disease that is a pandemic across the globe. And I mean, just today, we've heard the figures about India and how the latest stats are coming out saying that, you know, India, the number of people who died from the disease in India, probably because of availability of healthcare, it's not as readily available as we have here, was the number of people who died in India was grossly underestimated, and that it's likely that the number of people who died in India constitutes about 1/3 of the global deaths from COVID. So, you know, we have a devastating illness here. We know, and we've known for a long time now, that we can't stop people getting it, but we can stop you getting really sick from it, and we can significantly reduce the chance of you dying from COVID if you are vaccinated. Now, of course, we have to respect the fact that this is personal choice, but remember, the choices that we are all making not just affect us, affect our families and affect our communities. So if you aren't vaccinated, you're likely to get the disease, you're likely to spread it, and you're likely to spread it amongst your communities, many of whom may not be as lucky as you, and many of whom may not survive just because they're not as robust as you. So we have a duty of care, not just to ourselves, but to everyone around us, to protect people. And that was one of the issues that came up with Novak Djokovic, a very prominent figure who said it was his choice not to take the vaccine. And that's great, but what about the effect on the community, his community around him? So we have to lead by example and say, we know there's one thing that can reduce the chance of you getting really ill, really clogging up the hospital. So stop filling the hospital so that we can get on and treat the people who have other illnesses. And that's take the vaccine.
Thank you, Jyoti Ben. Very passionate as always. And thank you so much for that final message. Indeed, we all have a duty of care. Absolutely.
Thank you.
Thank you. One of the people who is on our film is Bharat Shah, the chair of Sigma Pharmaceuticals, who unfortunately couldn't be with us this evening due to a bereavement in his family. And so he has sent a message to us. And his message is, as a business that has been working in the sort of industry, the pharmaceutical industry, but also they have a vaccination center on site. And so I'd like Tushar Bhai, please, to read that message from Bharat Shah.
Jai Jinendra, and thank you, Prafula Ben. Thank you very much, Dr. Jyoti. So before I touch on what the message from Bharat Bhai, I'd just like to thank Nipa Ben, who from Brent Health Matters, the coordinator, the lead person. It's been an absolute pleasure from Oshwal Association to work with you, Yoel, and all the team from BHM. Really have enjoyed doing all the work with you, and I think the diabetes tea was so successful, and the meetings that we had afterwards, and may this journey continue forever. Yeah, this partnership that we forged with the Brent Council. So, as Prafula Ben said, Bharat Bhai has had a bereavement in the family, so our condolences to the extended family for the loss of their loved ones. But just to explain to you, Bharat Bhai is Oshwal member and the founder member of Sigma Pharmaceuticals, the largest independent medicine wholesalers in the country, and established for many, many years. So since the launch, what he says is, since the launch of the program in late 2020, Sigma has had a huge success on distributions of pharmaceuticals. And they also organized a webinar with the then vaccine minister, Nadeem Zavehi, who launched the vaccination to the pharmacy at the Sigma webinar in January 2021. This was a huge success, and 3 of their pharmacies actually got involved in providing vaccines, which a lot of pharmacies have, independent pharmacies, which you've all had your jabs, yeah? And what he says is, without the vaccination program, we will not be enjoying the freedom that we are now enjoying. There would be a lot more deaths. There'll be a lot more expense and a huge pressure on the NHS, which Dr. Jyoti just touched about, yeah? Bharat Bhai has had 3 vaccines, and he also got COVID-19 just a couple of weeks ago. And it was vaccines which actually minimize the symptoms that we had. A lot of people are catching vaccines, as is mentioned earlier on. The virus is mutating, so people are readily catching it, but the symptoms are not where you need to be hospitalized. People are suffering for 3, 4, 5, 6 days, and by that time, because of the vaccine, the symptoms are dying off. So Bharat Bhai, due to these vaccines, hasn't been able to travel. He travels a lot. In 3 months, he's traveled to 3 countries, and he's been able to pass through customs, immigration, flights, etc. And why is that? Because he's had the vaccines. So his message to all of us is, please, 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 if you've not taken the jab, take your jabs, get your booster jabs, and ensure that you protect yourself, but most importantly, you protect you, your family, and all your colleagues who work and live with you. Thank you, Prafula Ben.
Thank you very much, Tushar Bhai, for that message from Bharat Bhai Shah. I want to now introduce Dr. Anuja Shah, who is a GP with over 20 years of experience in general practice. Anuja Ben appears in our film also, and is here to talk to us. Just want to say a huge thank you, Anuja Ben, because I know tomorrow you too are flying off somewhere, and wouldn't have been possible if you hadn't had your vaccines. So thank you for joining us. So I've got a couple of questions for you, and I'm going to start with, as a GP, you've given some brilliant, excellent guidance and advice about taking the vaccine on our film. Can you tell us why this is more important in some communities, and what is your key message for them?
Thank you, Prafulaban. Jai Jinendra, everyone. So yes, Prafulaban, it's more important in some communities, particularly in the ethnic minority like our community, because we are more prone to having a serious infection with COVID, and in fact, we are more prone to having diabetes, as Nipavan was saying earlier, and hence, we are more prone to having complications due to COVID if we were to get it as well. So not only are we more prone to having a serious illness and complications from it, but also we live in multi-generational households. For example, in my family, we've got my mother-in-law, we've got my husband and I, and we've got my children. So we live in a multi-generational household where it's very likely for us to infect our elders. So it's important for us to take the vaccine not only to protect ourselves, but also our elders. The vaccine is very important to keep the community, the household healthy. As we know that with time, our immunity does wane. So we need to take our boosters as well in order to, as it says, boost our immunity. So it's very important for us to in our Asian community to be extra vigilant and look after our elders.
Thank you, Anuja Ben. And in the film, you've talked about the figures and the statistics, and we heard that around 1 in 13 people still have COVID-19 virus in the UK. What steps can we take to reduce the risk of serious illness from the virus, and what part does the booster program play in this?
So, as mentioned earlier, our immunity through the vaccines and even any natural immunity does wear off with time. So it's very important for us to take the boosters. At the same time, when we mingle with people, or when we've been asked to go to work, we've been asked to get back to normality, and of course that's important. It's important for us to get back to normality, but also at the same time, it's important for us to be sensible. So if we are in a crowded place, make sure that you're still using protection. You're still, wearing your mask, your hand washing, and all these steps actually do make a difference. We know that when we're, for example, when I'm at work, I still wear a mask. I wear gloves. I wear my apron. I wash my hands all the time, and these, although I'm seeing patients with COVID, these have protected me to a certain extent. But we know that when we're in the community, when we're in crowded places, and in the community, if you're not using these measures, we're more likely to get the infection. So PPE or protective equipment does actually work and does prevent us from getting the infection. So just to be sensible, if you're in a crowded place, take precautions.
Thank you. Great advice, and absolutely, really important still to be doing all of those things. We've heard loneliness and isolation across all age groups, including young people, particularly associated impacts are increasing, and includes poor mental health. So a lot of people with very, very, issues around their mental health. Are you seeing more people with these issues in your practice?
Definitely, we are seeing a lot more patients with mental health problems, loneliness, depression, suicidal risks, and I would like to emphasize over here, Prafulaban, that please contact your GP if you have any mental illness. GPs, as Jyoti Ben said, we are open, and we're open for business as we were before. But it may be that you may be asked to speak to a GP on the phone first. But it doesn't matter. Speak to your GP. Your GP, if they think that they need to see you they will ask you to come down to the surgery, or they will arrange for someone to come out and see you. So it's very important to speak to your GP. Mental health has been affected, and I've seen a number of people who are now anxious about going back to work, going back to normality. And I would like to say that it's important to take steps to gradually get back to normality. So it might be that you probably are nervous about maybe going back to work 5 days a week, but take small steps and have small targets and gradually build up the amount of activity that you're doing. That way you get more, you're less likely to get anxious or panicky about it. But going out, getting some fresh air, exercising definitely will help you with your mental and physical health. But speak to your GP, and there are lots of different ways your GP can help you. There are in the community, there are well-being services that are actually freely available. You can call up and get appointments to speak to counselors, arrange for cognitive behavioral therapy to help with your mental health. There are also social prescribers. I don't know if you've heard of social prescribers, Prof. Laben, but
yes.
But social prescribers are actually helping people with loneliness, so that they're putting people in touch with institutions or organizations who, and getting people in touch with each other as well. So, your GP can arrange for a social prescriber to come and speak to you. So, as I said earlier, I'd like to emphasize, speak to your GP. It's very important. Don't feel that we can't do anything. There's lots we can do to help if you're feeling lonely, depressed, anxious, panicky, and you can, if you're really desperate, call the Samaritans, call 111.
Thank you. And of course, there's that underlying message that you taking the vaccine provides a bit of protection, definitely from getting seriously ill, and that allows you to actually be out and about and go and see people and go to those community events that we used to go to. And they're very important for a generation that misses them and misses their friends that they may have been seeing at those events regularly as well. You said in the film that trying to get back to some sort of normality, you feel that COVID has been forgotten a bit. Can you expand on that, please?
Yeah, so we've now been asked to go back to work. We're now traveling. I'm going to be traveling tomorrow, so we're trying to get back to normal. And it almost feels like COVID has been forgotten. And people have stopped using precautions. But as I mentioned earlier, it is still important because COVID is still around. As I said, 1 in 13 people in the UK is getting COVID. It may be that we're not getting seriously ill with it, but COVID is still around. So it's important for us to take the precautions and to get boosted. Remember that vaccines and boosters are our only way out of the pandemic. We can see that the uptake for boosters is lower than the first and second dose of vaccines. So it almost feels like people are thinking that boosters are not important and they feel that COVID is now under control. But it's not the case, and your immunity will wane off. So it's important to get the boosters. If you're eligible for the spring booster, please go and get it. Get your spring booster. It's very important to get boosted.
And I think this is the one that is for people in that vulnerable category,
yes,
and those over the age of 75. I did hear today, though, that it's being opening up to more people. So I think absolutely, if we are eligible, then do get that booster as well. What would your final message be to our people who've joined our webinar today, and anyone who's still hesitating, perhaps, to take the booster or the vaccine?
Get the vaccine. You're not only going to protect yourself, but you're going to protect your loved ones and the community at large. We find from personal experience, we know that if you've you've got COVID, and if you are obviously mingling, say for example, if you're going into the cinema, or if you're going into a community event, you're likely to spread it to other people. So, if you get the vaccine, you prevent yourself from having serious illness, and you may prevent transmission as well. So get the vaccine. And the other message, obviously, is see your GP. GPs are open for business.
Just giving yourself more work there.
We'd rather have the work, as Jyoti said, we'd rather treat people earlier on than, I'm actually seeing patients with very complex illnesses. And, as GPs, we've got 10-minute appointments. Actually, 10 minutes is no way enough to deal with the complexity of the problems that we're getting nowadays.
Yeah.
It needs at least half an hour. It's, people are not coming in with one simple problem. It's just, one thing complicated by another. And people have left it for so long that it's actually becoming very difficult to manage now.
Thank you. And I wish you a very safe trip tomorrow. And thank you so much for joining us. I know you've still got packing to do and things. We have got a Q&A, as we always have on these sessions. And so I'd like everyone in the panel to join us for that. And we have got some questions already. And if you have any more questions, please do continue to put those in the chat on YouTube. Thank you. Tushaba is going to be here to support me with the facilitated Q&A. So do you want to go first?
Okay, so a technical question, and I'll go to Dr. Jyoti on this. Yeah.
There you go. Nipa Ben's there. Yes.
So a question, medical question. Is there any risk to the fertility of men or women by taking the vaccine?
So that's a really good question, Tushar. And so many young people are worried about that. But enough people have now had the vaccine, even if there was any doubt at the outset, because these are new vaccines and perhaps we don't have a long series of data, but we certainly do now. And we know now that these are safe, and there's no evidence that vaccines affect fertility in men or in women. And of course, initially there was also the doubt about whether pregnant women should have the vaccine or not. Was it safe? Wasn't it safe? I remember doing one of the first webinars on COVID in December, I think, was it 2020, Profulaben, with nearly 3,000 people. And at that time, just at that time, the evidence had come out to say it was probably okay, but we're not sure. And then gradually, we knew that it was safer for women who were pregnant to have the vaccine than to have the complications of COVID. I mean, in my hospital, I've seen someone die, a mother of 5, it was her 5th pregnancy, she didn't take the vaccine and she died, and she was very young. So there are tragedies like this. So, we know that the vaccine is safe. There is no effect on fertility.
Thank you. Profulaben?
Thank you. So my question, I think I'm going to ask Nipa Ben. And this question, I've heard it come up before as well. And this is people who have young children who are worried about the young children being advised to take the vaccine and what may be the sort of long-term effects of that. So we've got a question. Should 10 to 12-year-old girls and boys take COVID-19 vaccine, as schools have requested parents to do so? And will there be any consequences for children in future? So I don't know if in the kind of public health arena you're hearing this, Nipa Ben, and what's the sort of response?
So I think like Dr. Jyoti said, I think we all need to encourage each other, and that includes children as well, to have the vaccine, because children may not get the full symptoms, or they may get milder symptoms. But as I think Anuja Ben was talking earlier, we tend to live in multi-generation families. So if the children bring it home, it can have really bad consequences on parents, grandparents living together. So it is really important for us to get our children vaccinated as well. And all of the there are walk-in clinics that you can book your appointment, you can book through your school. So even for children, there are various opportunities and various places in every borough that you can go in and get your children vaccinated.
And as far as sort of research goes in this arena, and I'm hearing a lot about consequences in the future. And have you heard any more about that, Nipa Ben, in the kind of conversations that are happening?
So not at the moment. I think at the moment the public health team's concentration and full attention is to get as many people vaccinated as possible. And that's why, we've got pop-up clinics, we've got chemists that are giving vaccines. Like I said, we're going to schools. We've got, vaccine buses that go around to make access easier. So I think, and again, it just depends on what percentage people will have it. That will sort of determine the consequences later. So at the moment, I think we're hoping that we can still increase the numbers.
Thank you. So Shabai?
Yes, so touching on that same subject about children taking vaccines, when the pandemic first hit, we saw a huge number of the elderly population being hospitalized. And this was an article I read in the newspaper a few months ago. Since then, the number of elderly patients being hospitalized is dropping. And that's due to the fact that they're having the vaccination. But the young generation, the numbers actually being hospitalized, that number is actually increasing. Is that what you have found, Dr. Jyoti, in the hospital, whereby they're not taking the vaccine or reluctant to take the vaccine, the young generation? So their numbers are actually increasing.
So that was perhaps true earlier in the year. And I think in January, we saw quite a lot of young children being admitted or certainly presenting to the emergency department. What we're now seeing is the numbers are starting to come down, but we're still seeing predominantly elder people, and the highest age group is in the over 85s. And often that's because, as we've already suggested before, they're more likely to have other illnesses. And so they're more likely to have a weakened immune system. They may or may not have had the vaccine, but certainly the fact that you've got lots of illnesses that stack one on top of the other just generally reduce your resilience to this disease and therefore make you more likely to get it. We are seeing even those, but again, the over 85s, that's where we're seeing most of the deaths as well. But what we are definitely starting to see the numbers come down, but very, very slowly.
So touching on that same subject, and sorry, Prof. Lavin, you talked about immunity. Now, what are the supplements that you would recommend to actually boost your immunity? And that's from a pharmacist's point of view.
Dr. Shabai, I think you should answer that then. So yes. I think, look, there was one thing we knew for sure, and that was that we as ethnic minorities, that was certainly the emerging data at the outset, that we as ethnic minorities were more prone to getting this disease. Not only were we more prone to getting it, there were a disproportionate number of ethnic minorities who died from COVID, not necessarily in the older age group. And to give you an example, one of the very first doctors to die in this country 2 years ago was my dear friend and colleague, Amjad El-Harani, who was an ENT consultant with me in my hospital, every Tuesday operated next to me. And he was 55, got the disease and died. Now, he had no other illnesses. I know that for a fact. So what we do know is that and I don't think we know enough about it yet as to why we're more likely to get it, but that is a fact that we're more likely to get it. So we have to do everything we can to protect ourselves. If we know, if we know that it's going to rain, then we take an umbrella.
Yes.
Very simple. So if we know we're not more likely to get this disease, we're more likely to get sick and we're more likely to die, then do something. What can we do? We can take supplements And vitamin D supplements, you know, maybe that's less required at the moment once the sun started to come out, and we only need 15-20 minutes in the sun a day to get enough vitamin D through our skin. But actually vitamin D supplements, a well-balanced diet that includes the protein, the carbohydrates, and less donuts and less biscuits and less pendas, right?
Mm.
And certainly no jalebis. So and no torelu stuff.
Gatia,
exactly. Toreli vastu na khawani. So all the boring things, but a well-balanced diet, exercise regularly, all these things that give us the balance in our life, rest, enough sleep, and through a balanced diet, we should get really all the vitamins we need naturally.
Thank you.
Thank you. So I have a question, and I think this might be our last question. I'm just going to check, but how many days you should take care after COVID, please confirm. And I think this is a question around some of the confusion. And I've actually had someone today at the hospice asking me this question. Like, if you've had COVID, how many days should you now isolate? Some places have got their own policies, but what is the kind of national?
So we've got to remember that's a really good question. And the problem with that question is that there's a constant shift in you know, there's a paradigm shift in this every day almost, isn't there?
Yeah.
The guidance is changing. So how do we keep up with this? I mean, actually, the government says that you don't need to isolate anymore. You can go out, you can do whatever you like. So, but I think we have to be sensible. I mean, those of us who work in the NHS, if I get COVID, then I have to isolate for 5 days. Because of course I take it to the hospital. If everybody around me will get it, then we could knock out my department. There'll be no urology service in my hospital. But more importantly, I give it to my patients who by definition are coming in, because if they were fit, they wouldn't be coming into me. So if they're coming into a hospital, there's a problem. They have a problem. So we're going to make it worse for them, right? They get it, they're going to get sicker. So actually we have a duty of care to protect our colleagues as well as our patients. We have to isolate for 5 days, and then providing I have 2 consecutive day negative tests, then I'm allowed to go back to work, and of course my symptoms have settled. So if on day 6 I still have a raging temperature of 39, then I can't go back to work. And I shouldn't go back to work. Now, I think we have to be sensible in the community, and that's perhaps just the NHS. And again, different places of work may have different practices, their own rules about this. But in general, what do you do if you're out there in the community listening to this, thinking, oh, I'm going to get COVID tomorrow, what do I do? I think you need to be very sensible, because again, it goes back to, you don't know that the people you come into contact with are weakened in their immune system, are vulnerable or not.
Yes, of course.
And so if you spread it to them, they may not be as lucky as you, and they may get really sick. And of course, they may die.
So it's going back to one of our messages in the film, isn't it, actually? I've got a question from somebody who actually manages a community space, like a community center. And they're saying, obviously, they have lots of members of the public coming through their doors, trying to kind of balance that message between, have you had the test? Have you tested negative? Have you had the vaccine? And the balance of encouraging people to come through the doors to do those activities that are really important as well. So the question is, should we still encourage people to wear masks and use sanitizers? And are we suggesting that they perhaps, I'm not going to say bring proof of their vaccine, that they've had the vaccine, but a lot of places were asking for that, and now we're not seeing that. But actually in Europe, people are still asking for those proofs. So should they still be asking people to wear the masks indoors, use the sanitizers at the very least?
So I think it's very difficult when our leaders, when the government now says you don't have to do any of the above, it's very difficult to start enforcing it. And we certainly see that in hospitals, because of course, remember, in hospitals, we still have to isolate, socially distance from people, so that now instead of 2 meters, it's gone down to 1 meter, but we still have to maintain that distance. We absolutely still have to wear a mask from the minute I get out of my car to the minute I get back in my car at the end of the day. I have a mask on, not the same one, I do change it, that we have to, and of course we have to sanitize all the time. So, and we have to ask, because it's policy in our hospital, that patients who come in to visit us also have to wear a mask. Now that's hospital policy, so we can enforce that. I think it's very difficult if you're in a restaurant, in a bar, or in a public arena to enforce it when the government says you can go out and do whatever you want, really. So I think ultimately this boils down to individual responsibility. So I ask you the question, the public, what harm will you come to if you wear a mask? They are as cheap as chips now. So you're not going to come to any harm, and you may protect yourself, and you may protect people around you. So if you go into that public arena, wear it. You're not going to come to any harm, but you may just save someone's life. By washing your hands, by sanitizing your hands, and again, we've seen sanitizers in the supermarkets fall in price significantly, very cheap. So why shouldn't we sanitize? The thing I would say is, in Gujarati માં એનાથી કઈ નુકસાન તો નથી થવાનું ને. So, but you might actually be protecting somebody else as well as yourself. So these things boil down to, I think, individual responsibility. They're less enforceable because they're no longer statute in this country.
Thank you. Brilliant. Right, that was all from me. Have you got any more questions?
Yes, so a viewer has had 4 injections, including a booster dose. And since since January this year, he keeps getting bouts of flu regularly. He's tested lateral flow test and that's coming out negative. And what's the reason for this constant flu-type symptoms being recurring?
So I think perhaps, there's certainly no evidence that taking vaccines is going to lower your immunity so much that you're going to keep getting such illnesses. So maybe the person who's got that does need to go and have a conversation with their GP to see if there is an underlying problem.
Thank you. Nipa Ben, any final messages for our viewers today and the community from you?
No, just to say thank you to all of you at Oshwal community who's doing such fantastic work in the community. And as I said before, I'm really looking forward to working with you in the future. And please encourage everybody to get the vaccination. Thank you all.
Thank you. And a huge thank you from me also for Jyoti Ben. Keep coming back and don't be a stranger. We have got lots of topics still to consider and talk about, and we want to continue these webinars that have been so beneficial to the community at large. And this is, I think I said earlier, our 15th webinar, and we haven't run out of topics yet. So absolutely want to continue doing those. Dr. Anuja Shah had to go, unfortunately, because she has got a very early flight to catch tomorrow. And I'm so grateful that she agreed to do this despite the pressure of having to pack and get ready for that flight. So she's gone, but I do thank her very, very much for doing this. Nipa Ben, thank you for taking time out of your really busy diary to join us today. And I hope to see you again on another webinar maybe soon.
Yeah, not at all. It's a pleasure.
And Tushar Bhai, thank you for joining us and facilitating this Q&A. Want to thank Bharat Bhai from Sigma for that lovely message. Want to also thank everyone who was on the film, Radha, Mailesh Bhai, Jatin Bhai, Jayesh Bhai, our 2 medics, Jyoti Ben and Anuja Ben. And of course, finally, I want to thank Brent Council and Brent Health Matters for having the faith in us in producing this film, and I think it's going to do a really, really good job in getting these messages across to everyone and our communities. Nipa Ben, we are going to show it again at an event at Ekta Center a week on Saturday. So if you're free, it'd be great to see you there as well.
Sure.
I'll send
try.
you an email.
Yeah.
And so, yeah, we're going to continue showing it at many of our events, as we had said in our bid. And thank you very much, everyone, for joining us. It's been great to have you all join us. I saw on YouTube we're at I think 200 plus in numbers, and we always get more people watching these webinars as we go along. Perhaps they're not joining us this evening, but then they will join and watch it later. That's certainly our history in terms of some of the figures that we get from people watching them afterwards. I know a number of people have said to me that like to see it on YouTube so that they can share it with their own communities. So it will be uploaded to YouTube tomorrow, a slightly more higher resolution version of it than the one we've seen today. So thank you, everyone, very, very much, and see you all again
Hold on
very
1
soon.
minute. 1 minute, Prafulaben. Prafulaben thanked everybody, and I echo all her whatever she said. So thank you to all the team who joined us today. Nipaben, Dr. Jyoti, Dr. Anuja. But and she mentioned all the people in the video, but she forgot one person. Who did she forget? She forgot herself. Prafulaben, how can you do that? You know, Prafulaben has been a true asset to our webinars. She came to me with this idea, why don't we do this? And I said, do you have the time? She said, yeah, I'll make the time. So, but fantastic effort that she's been doing over the last 15, 18 months, finding the speakers, getting in touch with the case studies, etc., and a real asset to Oshwal Association, especially our Northwest area. So, Prafulaben, from the bottom of our hearts, big thank you. And I'm sure everybody at home is applauding you for all the hard work that you've been doing in Northwest area. Thank you.
Thank you. It's been a pleasure, absolutely. And I'm going to thank my partner in crime, Dr. Jyoti Shah, because we came up with this brainwave when we were chatting one day, didn't we? So yeah, no, it's been a really interesting time, and I think a lot of people have really appreciated these webinars, and I get messages all the time from people talking about them. So absolutely, yeah.
Thank you.
It's been great.
Good goal.
Thank you, everyone. I don't want to forget Nikunj Bhai because he's kept us on the straight and narrow this evening. Thank you, Nikunj Bhai. Can you please show your face? Because we'd like to see you now. There you go. So dear Nikunj Bhai has supported every single webinar, all 15 of them. And a huge thank you from me personally for that, Nikunj Bhai. And he sits in Leicester. So there you go. This is truly a Oshwal Global initiative. Brilliant.
Thank you. Thank you, Prof. Laben.
Thank you, Nikunj Bhai.
Right. Thank you, everyone. Keep watching. I think we've got one webinar coming up on mental health soon. And then a couple of other topics that we are exploring in May and June. Lovely to see everyone. Thank you, everyone. Jai Jinendra, and good night.